I'd like to know, we were just talking about grief just a moment ago, but
Mhm.
I'm interested to know, what else can people be doing to take care of themselves during this time?
Okay, so what we need to be doing, and I think it's good to talk about this on the back of us talking about the grief, is that it's really important to reach out to other people. We're all going through a difficult time. We're all feeling similar emotions. Lots of us are feeling lonely and bored. So it's okay to reach out. And I think, some of our culture is that, we don't bother other people. We don't want to be a burden. But it's really important, particularly for the elderly, particularly for people with children and juggling with jobs, to ask for help if they need it. If I could go into someone's house for an hour every day and help with their children, do.
Oh, Diane, you still there? Oh, okay. Sorry, we got cut off from Diane again there. Okay, Diane. So you were talking about grief, and you finished what you were saying, but I'm interested to know what can people be doing to help themselves during this time?
Okay, this is good because we've been talking about the grief, James, is that
Yeah.
we do need to be taking good care of ourselves and reaching out to other people for support when we need it. We are typically a culture that doesn't want to bother other people. We don't want to feel a burden, but we're all going through the same crisis here. And if we can help each other in what way we can, I know we can't go into each other's houses and do things practically, but if we can do things in another way, to do that. Still think about your own health is really important. I know people are not going to the doctors and going to the hospitals for fear, but speak to a medical professional if you're going through something that's bothering you. Obviously, don't turn up at NA, but speak to the medical people, because lots of people are worried about going into the hospital for their even routine appointments. But obviously not everybody with every ailment, but people that have got cancer appointments and things like that, we still need to be taking care of ourselves. Pregnant women still need to be taking care of themselves in that way. So it's important that we reach out for help and support and do as much as we can to help each other. And I think from what we were saying before as well is learning to stay patient with each other and accept that this is something that's going to happen for a little while yet. And the best way of taking care of each other as a community is to be patient and be understanding, that we're all going through this crisis together.
Yeah, not to get angry at the people that are there to help you.
Yeah,
Yeah, I'm sure it is frustrating that you're not getting the service that you want, but this is a different situation.
absolutely.
Yeah.
It's not worth losing lives.
Mm, mm. Okay, Diane. So, what are you doing at the moment in regards to helping people with their mental health?
So, in terms of being a therapist, therapists are still working out there. We're doing it very differently, although some therapists are online therapists anyway. But therapists have changed their business so that they're now doing online sessions. So that can be Skype or Zoom or telephone. So people that do need the mental health support, there is people out there still offering sessions. So if you do feel you need counselling, and some people have put it on hold, thinking we'll do all this when the lockdown's over. If you do need it, there are people out there that can help you. Some therapists have turned their hand to helping local charities, and they're offering free services for the NHS and other key workers. So therapists are still trying to do as much as they can and getting information out there to help with mental health. So don't neglect your mental health. If you need support, still seek it out.
Mm. And for people at home, if you are looking to book Diane, you can give her a call, and there'll be a number in the description, or maybe be on the screen right now. It'll be in the description of this video. So, you can contact Diane at home, and if you need therapy, then you can get in contact with her.
Thank you, James.